Welcome to the Homegrown Heart Podcast, every Friday morning at 7 a.m. Mountain Standard Time, with your host, Dr. Amanda Ryan, DO, MBA, interventional cardiologist, and an expert in her field. This week's topic, genetic testing, the pros and cons. Please help me welcome our host, Dr. Amanda Ryan.
Good morning, Carlsbad, Eddy County, and listeners all over the United States, and then some, we hope. Welcome to my Homegrown Heart. Today we're going to talk about genetic testing. Wow. First of all, heading into February, Heart Health Awareness Month. A lot of great events that Advanced Heart and Vascular Center of New Mexico, Partners in Heart Health, that are really sponsoring so many different events in our area in the next month. Plus, there's a lot of national chains that are doing different big events. The American Heart Association does a big Go Red luncheon. We're actually having a tie one on, tying the love together. Little ties that go on ladies' purses. They can go around trees. They can go just about anywhere. The idea is to really flood our city and surrounding areas, the whole country, with red during the month of February to really talk about what remains the number one killer of Americans: heart disease, cardiovascular disease, the combination of strokes, heart attacks, and congestive heart failure. So we really want to get out there and speak awareness. Again, February 5th, when this airs, we will have done our luncheon at the Carousel House, which is going to be very successful. We have panelists who are coming, ladies from our community who've suffered various forms of heart disease, and we're very excited to hear them share their journeys with us. On February 22nd, we're actually going to be doing a heart walk, a 1K or a 1 mile fun run, and a 5K that we'll be doing here in Carlsbad, raising money for heart disease awareness. On February 14th, I'll actually be a speaker at a Galentine's event for the Women of Greater Carlsbad, where we're going to talk about heart disease awareness too. So many opportunities to learn. Also, if you're following my TikToks, my Lady Heart Doc for Life, Instagrams, and Facebook, you might have seen that the United Way has put together an amazing group of local celebrities. Thank you guys, Danny, Kyle, volunteering me. I have an outgoing personality, as I stated. I have really been singing Kids Incorporated shows. I don't know how many other people used, the paper towel or toilet paper holders with the little aluminum foil on top and made their microphones. My grandmother, who adored me, of course, would make the whole family come and watch our little productions. Julie, Jennifer, my cousins, shout out to us and our Kids Incorporated days. And I have always been front and center from preschool shows forward, but I've never been able to sing or dance. So I'm a great candidate for this United Way Dancing with the Stars fundraiser that's going to be April 18th at the Civic Center. We have professional dancers coming from Utah, actually, to help work with us and get us ready. So many great things coming up for our community. Get involved. I hear so often that there aren't good things to do in Carlsbad. There's not enough activities. We have some great activities coming, especially any that involve getting active and getting out there. Again, our Heart Walk on the 22nd is a great opportunity. So I encourage everybody to get involved. Today, the point of the podcast was to talk about genetic testing. I think that's it's a hot topic, quote unquote. But what exactly do we mean when we say that? I guess sometimes that's a thing. Like, somebody will come in my office, they're like, what do you think about genetic testing? Well, ever since the Human Genome Project really got going, and when was that, mid-90s to late 90s, and continues, as we're really able to unlock so many different genetic things. I think in cancer research, there's so many good things that have came around out of the Human Genome Project, and us really being able to figure out on an exact molecular level which proteins are causing certain cancers, and really be able to direct our chemotherapies towards some of those. Now, again, I'm not a cancer research expert, so just speaking from my limited knowledge as a cardiologist, that there's been a lot of advancements. We've also been able, as we target, we can decrease a lot of the potential side effects of some chemotherapies in the past would maybe just have to target all cells. Now we're able to direct it towards certain cells and certain proteins on those cells. So much progress. But every negative has a positive, and every positive has potential negatives, right? So we're talking about genetic testing on a widespread basis. The whole thing is, can we handle the information? Can the information be used in a negative manner? So these are some of the things we kind of, and you might say like, well, again, how can information be used in a negative manner? How about from an insurance standpoint? If you have a certain genetic condition, is it fair or acceptable, and will insurance plans either fail to insure you or make you pay at a much higher rate? Again, I think we've mentioned and you've seen our episodes with Dr. Barron's team and with Summer Gonzalez about her family's condition of Loeys-Dietz. That's Loeys-Dietz. Summer, her mother, her grandmother, so many in her family are affected by this disease, and they're also advocates for knowledge, advocates for genetic testing, advocates for early intervention, as their lives and so many others have been affected by these and other genetic diseases. As part of that, Summer has really begun to help our patients steer them towards safe and appropriate genetic testing. So Invitae, that's Invitae, and again, there are a lot of different options, and I'm not here to encourage necessarily one or another. I'm going to tell you about our positive experiences, though, with Invitae. This is a very broad genetic testing that then you can split down. If you go to the website, you can actually choose your panel, and based on different things that are either in your family or the group of symptoms that you might have to make us concerned. For example, Summer's family, we tested for all kinds of what we call aortopathies. Those are, again, stretchy aortas, things that make the aorta not respond the way, quote unquote, normal tissue in an aorta will respond. These patients are at high risk of aortic dissection, which is often fatal. I just had an amazing young lady come to my office in the last few weeks who's going to be on our panel, doesn't mind her story being shared. She actually was born with a bicuspid aortic valve. That means she had 2 leaflets instead of 3. In and of itself, that might not be a big deal when we're younger. Often, instead of opening, I tell people an aortic valve should open like a reverse Mercedes-Benz sign. That's what it should look like. It's like this as opposed to this. Some people have only 2 leaflets, so theirs is a little more like this. Therefore, it doesn't tend to open all the way. Often, by our 50s or 60s, or maybe even earlier, this valve ends up needing fixed. It either gets very tight or stenotic in some people, and in other people, it gets very leaky. We call that aortic regurgitation or aortic insufficiency. That actually needs to be replaced, sometimes even the whole root replaced or repaired, which there's technologies advancing every day for this. So this patient, who again is late 30s, early 40s range, she had had testing until she was about 17 with yearly echocardiograms. Those are ultrasounds that really evaluate the heart structurally. And everything was okay, and she kind of felt fine, and she really didn't follow up, make a transition from a pediatric cardiologist to an adult cardiologist. And again, there were limited options in the rural area that she lives, and she felt fine. For about the last 2 or 3 months, she just wasn't feeling well. She didn't know exactly how to put her finger on it, just fatigued, overall feeling of just something isn't right, a little bit short of breath when she exerted herself, but she really couldn't put her finger on what was going on. Knowing her history, she thought, maybe I should get my heart checked out and just see if there's something going on there. Well, she actually woke up the day she had an appointment scheduled at our office. And she said she felt like a shotgun go off, a pop in her chest. she was kind of stunned, and she just stood there like, not really sure how to process what had happened. And she said, my immediate thought was I would go lay down. I am very grateful that she didn't go lay down, by the way. She went into the bathroom first. While in the bathroom, she then noticed she had no feeling in her right leg and then her right arm. That whole right side of her body was starting to feel like it was on fire. She was able to tell her boyfriend to take her to the emergency department, call 911. She needed to get care immediately. She had suffered an acute aortic dissection that went all the way up from her head all the way down to her feet. She had dissected her aorta from the top to the bottom, essentially. So I'm very excited to say that she's alive and doing very well, and that she's willing to share her story. I think there's a lot that could be learned from her experience. I think genetic testing, well, she knew she had a certain genetic condition. I think there's other genetic tests that she could have been tested for as well. And I think routine follow-up and checking echocardiograms on a regular basis, and we could have changed the course from an acute emergent situation to more of a semi-elective situation. Now again, these are fancy words, but they kind of have a lot of relevance, which imply what your chances of, meaningful survival really are. In the healthcare sector, we refer to aortic dissections as the great masquerader. Why do we say that? Because classic stabbing chest pain that goes straight through to my back is definitely a sign of an aortic dissection, but only about 1/3 of patients with an aortic dissection describe those symptoms. Again, patients don't read the book. Very rarely. Now, if you do come in when they're having a heart attack and tell me, I feel like an elephant sitting on my chest, but that's few and far between. Again, another patient that's going to be on our panel does have a strong family history of heart disease. Her only symptoms have really been indigestion. She's had 8 stents put in at different locations in the last 6 to 9 months. Finally came to me saying she's still feeling this indigestion. She'll get better for a little bit after she has some stents placed, then this indigestion feeling comes back. And when we did a repeat angiogram on her, we actually found that all 3 of her vessels at some point in the vessel are actually 100% blocked. She's going to need to go for open heart surgery. She's very fatigued and she has chest burning consistent with indigestion. She does not have chest pain, and you can ask her 20 times and she'll tell you this is not chest pain. So just again, knowing what we're genetically predisposed to, is this helpful or is it not? Now, sometimes, again, I hear people in my office like, oh, well, it's my genetics. It's just the way it is as far as blockages or weak hearts or other things. Again, sometimes our habits and life choices can either light a match to our genetics, or they can help us prevent developing the same things that potentially our parents did. Predispositions to genetic cardiovascular disease versus genes that lead directly to disease, there's also a lot of variance there. Again, aortic aneurysms or dissections, certain arrhythmias, cardiomyopathies, which are weak hearts, and heart attacks, myocardial infarctions. Again, there are genetic markers and genes that predispose us to all of these different factors. One area of genetic testing we've been doing for a while is hypertrophic cardiomyopathy. We used to call this HOCM, hypertrophic obstructive cardiomyopathy, or HOCM. All hypertrophic cardiomyopathy is not necessarily obstructive, so we've changed the terminology to HCM. The classic is a young male African-American athlete who in high school or college, while really exerting themselves, has a sudden cardiac death on the football field, on the basketball court, on the soccer field. This has led to a lot of push to say, hey, we need to be checking EKGs on athletes. And if these EKGs show anything, we need to be referring them to cardiology and getting echocardiograms on patients so that we can really identify somebody that has a thick heart muscle at baseline may be okay with light or routine activities and not have a symptom. But particularly if they get dehydrated and overly exert themselves, they may have a sudden cardiac death. So again, there are certain hypertrophic cardiomyopathy conditions and genes that if we know you have these genes, you'll probably get a defibrillator, which is a special kind of pacemaker that goes in under the skin and puts leads in your heart that can actually shock your heart back into a normal rhythm. We may also recommend not doing some physical activities for those patients. So you want to get genetic testing, or someone has recommended you get genetic testing, or your mom has called and said, hey, I have Ehlers-Danlos syndrome and you need to go get tested. The first thing I used to say to people in that instance, let's call this 10, 15 years ago when this stuff was first coming out, is, you know what, you need to get in with a geneticist. And genetic counselors are amazing. These are master's or PhD trained geneticists who really can sit down and help decipher your genetic profile, the results of your test, and help guide you. Things like, should you have children if you're a female? These things are, they're the ideas that come up. Is my life expectancy going to be changed? Should I change my career path, my athletics, my workout routines, my job? Again, all these things. Do we need to change them based on our genetic? But how easy do we think it is to get in with a geneticist here in rural America? For sure. I think Summer's mother did when we kind of pieced her stuff together in reverse, that she must have some kind of underlying genetic condition because she was having, again, aortic aneurysms and heart attacks in a patient that just didn't have the traditional risk factors. Those are the kind of patients that make us say, we should probably look at their genetics and figure out if there's something else going on with this person. I think it was 9 to 12 months to get into the geneticist, and she lives in urban, suburban Salt Lake City area. So while that's great, and any of you young ladies interested in STEM, genetic counseling is an amazing area that we really have a shortage. So that would be a great area for people to get interested in. It's fascinating. Biology, really get to the core of biology studies, be involved in a lot of research, and really help a lot of patients. Because let's say, okay, so we're going to go on Invitae, and how much does the stuff cost? That was another thing. Actually, a lot of these different companies provide, after Summer's mom tested positive for Loeys-Dietz, they paid for that genetic panel for the 35 different conditions that they were tested for all of her offspring, her parents, her siblings, all for free. If you had to self-pay for that, the panel they got was $350. But again, after one person has tested positive, in a family, they'll often cover any further genetic testing. And again, why even as industry are we interested and motivated to help people understand their genetic profiles? Because if we can study them, again, Loeys-Dietz was just discovered in 2005 by a group of researchers at Hopkins. If we can piece together things in a family and then link them back to their genetics, that helps us understand for so many more people moving forward. There are still a lot of things that we don't have figured out. A lot of things in neurology, cardiology, cancer. There's a lot of different disease processes that as scientists and physicians, providers, we still have a lot of understanding left to go. studying people's genetic makeups and their predispositions really going to help advance technology so that we can help more people. So again, let's say we're Summer. Now, okay, she has Loeys Dietz. It's an autosomal dominant inherited trait, which means if you get it, the gene, you have Loeys Dietz, period. Okay, but there are varying expressions of it. If you go look at Loeys Dietz in particular, there are all kinds of different skin conditions, GI conditions, inflammatory arthritis, so many different things that can go with it. Summer, my amazing director of operations, who really did not want to give in to having an underlying genetic condition. She was kind of trying to put her head down and say, I'm fine, I don't want to deal with it, I feel fine, I don't have any of these conditions. Has since kind of been forced by life, and again in her 20s, having 2 major open heart procedures already. She's kind of been forced through a lot of encouragement from her mom and Dr. Barron and myself to really say, hey, I've got to be realistic about what my condition is. I've got to understand my symptoms, and I've got to talk to people that know how to guide me. I've got to do some things preventive. Most recently, we're really trying with all of us in our office on this health journey. I think I told you about it's going well. Everyone is showing good health improvements in the last month. I can't believe January is over. That's kind of crazy. I'm still saying 2024 most of the time. But as part of that, really trying to push through this health journey, we're trying to really focus on anti-inflammatory diets and improved health overall. Summer's been exercising regularly and really focusing on anti-inflammatory foods with a well-balanced diet. She's reducing weight and feeling 1,000,000 times better. Better energy, less headaches, less joint aches. So all of these things, using our genetic profiles to try to figure out if we really do have some of these underlying conditions, and if we do, what can we do about it? How do we be proactive? Again, I'm going to pull this discussion back to our frustration with the big insurance companies, with quote unquote big pharma, with large healthcare conglomerates. And again, I've shared in a previous podcast that it's my opinion that there's a lot of blame to go around in healthcare delivery in the United States and how we could all do better. But patients and we are an active part of the issue. We have got to switch from reactive to proactive. We've got to be willing to invest in our own health the way we're willing to invest in our hair and our cell phones and our technology advancements. And I am just as guilty as everybody else. But we've got to invest in our health before we're looking at scary end-of-life potential diagnosis where we then, oftentimes it is too late to reverse things. And all things are not quote unquote created by ourselves. Sometimes you play the hand you're dealt in life. People don't want to have underlying genetic predispositions to all these crazy cardiac or otherwise diseases. But if these are the genetics that you have, and let's say you don't eat well, you're 100 pounds overweight, and you smoke, you are really, truly just igniting your genetic underlying conditions. All right, I think that's a good intro into genetic testing. I hope this stimulates a lot of different thought and discussion, and we'll do a follow-up podcast in the future about more genetic testing and getting into some more details. Hope everybody has a good week. And again, February is going to be a lot of talk about heart disease awareness, particularly in women. Thank you.